Hi guys, I'm Yifan Liu from UCSD. I work for Dr. Sonia Norman's lab and my advisors are Dr. Luciano and Dr. Hugh. All data in this study was collected by VA San Diego Health. Today I'm gonna talk about testing guilt as a moderator of the association between PTSD severity and suicidal ideation among veterans. As we know, suicide is a pervasive problem among veteran populations. Veteran suicide rates was 66.3% higher than the civilian population. The presence of suicidal ideation has been identified as an important precursor of suicide, and lots of studies suggest that greater SI is related to a higher risk of subsequent suicidal behaviors. Post-traumatic stress disorder, as one of the most frequently diagnosed psychiatric disorders among veterans, has been identified as a risk factor for suicidal behavior. Some research has found that SI is strongly associated with PTSD symptom severity. However, are there any other factors that can influence the relationship between PTSD severity and the presence of SI? One factor is trauma-related guilt, which is a distressing feeling and/or belief that one should have thought, felt, or acted differently during the traumatic event. For example, if I have done X instead of Y, my fellow soldier would be alive. Based on the interpersonal theory, the presence of assaulted belongingness, which is a feeling of I am alone, and perceived boundlessness, which is I am abundant to other people, contributes to a higher level of SI. Trauma-related guilt may contribute to both feelings, thereby exacerbating the effects of PTSD on SI in veterans. To our knowledge, no study to date has tested whether trauma-related guilt moderates the relationship between PTSD severity and SI. Therefore, our research question is whether guilt could be a moderator in the relationship between PTSD severity and SI. Specifically, whether there will be a strong association between PTSD and SI for veterans with high levels of guilt than for veterans with low levels of guilt. In this study, there are 184 veterans who endure trauma-related guilt. The majority of this sample are white males. Regarding measures, most studies use self-report measures for PTSD and SI, but we use clinician-administrated interviews, which has higher validity. The results significantly shows that veterans with higher PTSD severity are more likely to report SI, which is supporting the previous study. Surprisingly, our study failed to find a significant correlation that guilt as a moderator of the PTSD and SI relationship. In addition, we tried to control some other covariant variables, such as race, age, and sex, and the results also remain unchanged. Our work has several important implications for future research and clinical practice. For example, our finding that PTSD severity is positively associated with SI may suggest that it is important to screen for and target SI in the context of PTSD treatment. In addition, combined treatments might be warranted to reduce both PTSD severity and SI. The limitations of this study are the nature of the data. Our data were cross-sectional and the data of the sample was lack of diversity. We also measure SI as a dichotomous variable. Future studies could target these limitations to conduct a longitudinal study with more diverse gender balance, racially diverse, or civilian-based samples, and measure SI as a continuous variable to gain more statistical variability. Thank you.